At least 20% of children will require a surgical procedure before adulthood, among them correction of undescended testes. That is what's being done on this 3-year-old here at Kenyatta Hospital. For 15 minutes, scientists in this theatre prepared the 3-year-old patient to ensure that he experiences a painless surgery while alive but unconscious.
From our monitors, we can tell that the patient is alive. There's a heart rate. We can tell the patient is saturating, getting in oxygen well, and the patient is breathing.
Once the preparations were completed, the surgery officially began. Surgeons sought to correct this patient's left testicle that failed to descend during formation before birth.
When the children are in the womb, the testes are usually inside the abdomen, and they have to descend, pass through the groin, and get to the scrotum by the time the babies are born. So you find that there are some children where by the time they are born, these testes can get stuck somewhere along that line.
Failure to be treated for undescended testes has dire long-term consequences.
The longer the testis is out of the scrotum or high, the higher the risk of infertility and testicular cancer.
Parents are advised on some symptoms to look out for that could point to the need for medical intervention, particularly by a pediatric surgeon.
It's always advisable for the boys, mothers, fathers to just check in the scrotum and see if you can feel both testes. If you cannot feel them, it's advisable to just get checked and be confirmed for the diagnosis.
Elsewhere in the world, we interact with Millicent Ragot and Linda Wamboi, who are well aware of undescended testes.
Mtoto wangu nilimzaa na hiyo shida, but immediately vile nilimzaa after 1 week niligundua. Nikimfunga pampers, nilikuwa naona upande moja imehang.
Miezi 2 iliyopita mtoto wangu alianza kufura kwenye sehemu zake za siri.
The two, however, have since benefited from the Kenyatta Hospital project as their sons have been fully treated. This project is fully paid for by the National Health Insurance Fund. Since Kenyatta Hospital announced the treatment for hernia and undescended testes, about 20 children are operated on daily. The challenge is the inadequacy of pediatric surgeons, of which there are approximately 35 in the country.
We really need to train a lot more surgeons. The good thing is that we have a training center here in Kenyatta National Hospital in conjunction with the University of Nairobi.
Ben Kerera, K24, Nairobi.